In regards to OCD, there's a whole classification of disorders called OCD disorders, but they're typically we talk about obsessions and compulsions. So obsessions are thinking patterns. So the way that I'm thinking, and it becomes obsessional. So we're not talking about like once or twice or three times a day. It's like dozens to hundreds to thousands of times a day. This is all I think about. So whenever I see something, that's the filter I see through. So if I'm worried about things, one of the classic ones is contamination. So it's not that I have a thought of like, oh, I wonder if there's something on my hand. Is I'm scanning the room and looking for things that are dirty. Can I touch that? Should I even walk over there? Did that other person touch it? So there's an obsessional way of thinking that somehow it's so focused on my mind that I can't get out of that. And to lower the anxiety around those thoughts, if I give into some compulsion, then for that moment, it decreases that level of anxiety for just a little bit. However, then the thought just keeps on coming back and back and back again. So when we have obsessive compulsive disorder, I have an obsessional thought, and the types of thoughts can vary from anything from things are contaminated to checking, did I really close the door and lock it, to sexual thoughts that I find obscene or distressing, to religious thoughts about my relationship with God, to harming other people or harming myself. So there's a whole different range of obsessional thinking patterns and a whole range of compulsions, anything from physical things, I have to tap things in a certain number of times or avoid good and bad numbers, to I have to range of physical things, to we have called mental compulsions, where it's just all in my head and I'm doing things in my head, like counting the number of words that I'm saying and making sure that they don't add up to a bad number. So there's all sorts of different compulsions based on that obsessional thought. But the idea is that compulsion decreases my anxiety about having that thought in that moment.